Hi, my name is Shayna Mitchell. I'm introducing myself this evening to the patient. I will be your nurse practitioner. I've already washed my hands. Right now we have the patient getting ready to partake in a musculoskeletal examination. So right now I have the patient standing facing me at this moment. I'm going to ask the patient to look down at the ceiling. Look up look up above your head. I'm sorry. Look over both your shoulders and touch your ears from shoulder to shoulder. Touch your ear from shoulder to shoulder. Yeah. I'm now going to ask the patient to shrug his shoulders against resistance. Okay. I'm going to ask the patient to abduct his arms to 90 degrees. Okay. And abduct. Good. Now I'm going to ask the patient to internally and externally rotate your arms. Thank you. Go ahead and spread your fingers wide apart. Make a fist for me. Okay. With your arms at your side, I want you to pronate and supinate your hands. Okay. Go ahead and tighten your quadriceps for me. Contract them. Relax them. Okay. I want you to turn towards me. Turn your back towards me. I'm sorry. And then with your knees straight, I want you to touch your knees for me. And so while the patient is touching his knees, go all the way. I'm just palpating and assessing the cervical spine. Any pain or tenderness?
No.
Okay. Go ahead and duck walk towards the front of you and then duck walk back. Okay. Go ahead and face me. The patient is currently sitting in an erect position. His neck is supple with some symmetry noted on both sides of his carotid. I don't see any jugular vein distension going on in his bilateral sides of his carotid area. I did assess the patient's cervical, thoracic, and lumbar spine just to see if he had any displaced curvature or if there was any convexity or concavity going on, but there's nothing at this time. Patient does have a strong gait. He was able to follow instructions during his duck walk and other anatomical areas. I just assessed the ligament alignment of his shoulders and iliac crest with him standing in an erect position. And then I noted with him flexing and extending, he was able to follow those commands without any deficits. His spinous process was not tender. I palpated his cervical facets for tenderness, the paravertebral muscles for tenderness or spasms. I palpated the sacroiliac joints for tenderness. And I also palpated for tenderness in other areas that the patient might have suggested during this examination while the patient was bending over to touch his toes. The patient did promote positive flexion and extension, rotation, and lateral bending in his neck. He also exemplified flexion, extension, rotation, and lateral bending in his spine. Next, I'm going to inspect the patient's upper extremities specifically. I'm going to hold your arms up. And I'm just looking for any type of symmetry, deformity, or swelling, or any discoloration. Open hands. Any pain to touch?
No.
Okay. Hold your arms down. So Looking at the patient's ligaments, any landmarks during palpation, the sternocleidomastoid and clavicular joint at his acromion levels. Any pain here?
No.
What about when I ask you to shrug your shoulders?
No.
Okay. He was able to lateral supinate and pronate his elbows with flexion and extension at the ulnar nerve as well. Go ahead and place your palms towards me. Right now, I'm just assessing the patient's wrist area. Flex your wrist. Flex it and extend it. Okay. Any pain?
No.
Okay. For the patient's shoulder areas, he was able to abduct and adduct. His wrists there were negative deficits for any ulnar and radial deviation. As far as special tests that are concerning when we're talking about the musculoskeletal assessment, we look for forearm supination, the Neer and Hawkins impingement signs, or any drop arm signs or empty can tests. For the wrists and hands, those special tests will include Tinel and Fallon signs. And all these exams were performed with bilateral comparison and adequate exposure. Obviously, we cannot expose the patient with the actual gown. However, if he was in a clinic, he would have an actual gown on so that we could further assess the patient in detail without being recorded. Lastly, I'm going to assess the patient's lower extremity. So again, he did the duck walk, so I observed for his gait. I'm just looking right now at the patient's knees for any swelling, any deformities, any muscle atrophy in the hip area, anteriorly and posteriorly. I'm lifting. Go ahead and lift your leg up for me if you can. So the patient is demonstrating some moderate good balance. I'm just looking at his ankle and foot area, pulsating the posterior tibial area. Go ahead and abduct your hip. Okay, put your leg down. So looking at the patient's iliac crest and his hip, assessing his greater trochanter and the posterior superior iliac spine. Additionally, with the patient, I was looking at his ankle and foot. So I did palpate with my thumbs along the anterior joint space to assess for any swelling. Patient did have slight discoloration on the feet. However, we have patient does work in the occupation of trades. I did palpate the Achilles tendon for any nodules, any tenderness.
No.
On this side.
No.
For any nodules, assess the patient's calcaneus and plantar fascia for any tenderness as well. Go ahead and push your toes on my fingers. Push down. Okay, lift up. Okay, push down. Okay, lift up. So the patient has really good strength in his pedal area and phalange areas. Next, I'm going to ask the patient, we're going to assess his knees again. I'm going to actually, you sit in a squatting position. Thank you. And stand up straight. Okay. So earlier the patient was, prior to this assessment, was sitting on the very edge of a chair, not a table. And he did have his knees bent, and he was able to flex and extend his knees. Some special tests that are included for the knee areas would be, we're looking for signs of bulging or minor effusion. We would be assessing for the McMurray test or vagus or varus stress test for any type of ligament injury. Adequate exposure was provided. Patient performed adequately during all exams with bilateral comparison and no deficits noted to any of the areas assessed. Thank you. Bye-bye.